Hi, my name is Elise Anna Harris, and I'm a three-time triple negative breast cancer survivor. Here, sharing my experience, praying, hoping that it encourages those who are currently going through. October is Breast Cancer Awareness Month. As a three-time triple negative breast cancer survivor, every day is survivor mode. Today's topic, I will be sharing with you Cancer News Information 2023. I want to dedicate this show for the month of October to all the breast cancer patients, survivors, loved ones who know someone who is currently going through. I pray that you would share this video and information that's presented on this video to those who you believe would be able to benefit from it. One of the items I wanted to talk with you today about is regarding the First Lady Jill Biden. They announced a Medicare proposal to help patients pay for navigation services. And what a patient navigator is, it helps patients navigate insurance claims to create a payment plan, when necessary, document and resolve any complaints lodged by the patient and or the family member. Also, another item for talk about, it's called post-mastectomy pain syndrome, and it's the side effect of a mastectomy. And for those of you who don't know what a mastectomy is, basically is when a breast is being removed, is what a mastectomy is. And there is post-mastectomy pain syndrome, and what causes that? During the surgery of the breast being removed, um, there are nerves that run toward the armpit, inner and outer chest, are pulled out during surgery. The surgical options for treatment would be you would contact your surgeon, your primary care doctor, your oncology doctor. Primarily, actually, would be the oncology doctor, and you will schedule a visit. And then what they will do, they will locate the affected area, release the nerve, remove the abnormal ending of the scar. Also, too, the nerve endings of the scar until a healthy segment is reached. And then what they'll do is to reconnect to another healthy nerve. It's important to have the neuroma, the mass, or the tumor removed, because if nothing is done um, to do that, to remove that, another tumor can form and the pain can reoccur anywhere from 3 to 6 months after surgery. Also, too, frequently asked questions you can ask your breast cancer surgery, your oncologist. What do you do to minimize, if you haven't had a mastectomy, what can you do to minimize the issues with the nerve cut? Do you use clips during surgery? What would you recommend as far as physical therapy? Also, too, there is currently a shortage on chemo drugs. From the American Society of Clinical Oncology, certain drugs that there's a shortage on for the breast, head, neck, ovarian, esophageal, testicular, bladder, pediatric leukemia. There are certain shortages on those. The American Society of Clinical Oncology recommends need to speak with your oncologist, but they would recommend different medications if the ones that you're needing for your particular type of cancer is unavailable. So one of the things that they're suggesting is that to increase your length of time between cycles, minimizing or omitted limited agents for reoccurrent agent resistant. The root of issue is numerous according to the American Cancer Society, demand is great, slow, low profit for generic drugs. Drugs are up for ration and they're given to the oncologist, and it's up to the oncologist to decide whether or not, as far as who would receive the chemo. And then also, too, by it being a shortage of chemo drugs, it also can impact the cancer outcome. If not given the chemo, um, is the only choice, increasing frequency is reasonable. There are different types, different treatments that are costly. Alternative regimens to replace a platinum based combination may prove to be more expensive. If the patient has a copay, possibly it could be higher. It depends on the type of insurance that you have. And the patient and family member need to contact their lawmaker regarding the cancer, the chemo bill. My name is Elise Anna Harris, and I'm a three-time triple negative breast cancer survivor. Here sharing my experience and providing relevant cancer information that you can share with your family members, friends, those who currently may be going through. I pray you find someone that who is going through that you be able to share this information with them. God bless you, and thank you for tuning in and listening. And God bless.